Nerves. Published by WordPress.com. Thoracic Outlet Syndrome, TOS. Definition. Thoracic Outlet Syndrome, TOS, is a condition in which the lower trunk of the brachial plexus, along with the subclavian vessels, becomes stretched or compressed as they pass over the thoracic outlet, leading to neurological and/or vascular symptoms in the upper extremity. Epidemiology. Commonly affects individuals aged 18 to 50 years. Bilateral involvement is possible, more prevalent in athletes, particularly weightlifters, and those involved in activities with repetitive overhead movements. Anatomy. The thoracic outlet is defined by the following boundaries. Anterior, scalenus anterior muscle. Posterior, scalenus medius muscle. Inferior, first rib. Pathophysiology and etiology. 1. Cervical rib. A congenital anomaly where a costal process persists at the C7 level, forming an additional rib. 10% of individuals with a cervical rib will develop TOS. Can be complete, with a fibrous band attached to the first rib, or incomplete. 2. Scalene muscle abnormalities. Tight or hypertrophic scalene muscles can compress the brachial plexus and subclavian vessels. Accessory muscles or fibrous bands may also contribute to compression. 3. Clavicle and first rib malunion. Abnormal union of the clavicle or rib can compromise the thoracic outlet. 4. Vascular anomalies. Compression of the subclavian vein or artery can occur, such as in Paget-Schroeder syndrome, especially in athletes. 5. Pancoast tumor. A tumor at the apex of the lung that may compress the brachial plexus and/or subclavian vessels. And 6. Trauma. Acromioclavicular, AC, dislocation, particularly type 4, can alter the anatomy of the thoracic outlet, contributing to TOS. Pathology. Neurogenic TOS. Sensory symptoms, pain and paresthesia along the ulnar aspect of the forearm and hand. Motor symptoms, weakness in intrinsic hand muscles, with possible wasting of the thenar and hypothenar muscles. Sympathetic involvement, affects the upper extremity, potentially leading to Raynaud's phenomenon and cold intolerance. Vascular TOS, subclavian vein compression, leads to chronic upper limb venous insufficiency. Subclavian artery compression, results in chronic ischemia, causing intermittent claudication. Clinical presentation. Neurological symptoms, pain, numbness, and paresthesia along the ulnar side of the forearm and hand. Weak grip due to intrinsic muscle weakness. Muscle wasting in the thenar and hypothenar eminences. Vascular symptoms, acute pain and swelling, due to possible deep vein thrombosis, DVT. Intermittent claudication and cold intolerance. 5 petaseconds, pain, pulselessness, pallor, paresthesia, paresis. Provocative tests. Right test, positive if symptoms worsen with hyperabduction of the arm. Adson test, positive if symptoms worsen with head rotation towards the affected side while extending the neck. Ruse test, positive if symptoms increase with sustained arm elevation and opening, closing of the hands. Imaging. X-ray, cervical spine, to detect a cervical rib. Chest X-ray, CXR, to check for a Pancoast tumor. MRI, to visualize fibrous bands or other space-occupying lesions. Angiogram, to assess vascular anomalies, such as subclavian aneurysms. NCV-EMG, helps to differentiate TOS from other peripheral neuropathies, such as carpal tunnel syndrome. Differential diagnosis. Peripheral neuropathy, cervical radiculopathy. Treatment. Conservative. Activity modification, avoiding repetitive overhead movements. Physiotherapy, focused on strengthening and stretching exercises for the shoulder girdle and neck. Weight loss, reducing overall strain on the thoracic outlet. Operative, indicated for failed conservative management or severe symptoms. Vascular reconstruction, if vascular compression is present, e.g., subclavian aneurysm. Clavicle malunion repair, correcting malunions of the clavicle. First rib resection, to relieve compression at the thoracic outlet. Cervical rib excision, if present and contributing to the compression. Scalene muscle division, to relieve compression from the scalene muscles. Release of fibromuscular bands, to alleviate pressure on the brachial plexus. Pectoralis minor tenotomy, if pectoralis minor muscle tightness is contributing to compression. Complications. Embolism, potential for emboli to the hand due to vascular compression or post-surgical complications.